So what should you expect if you have your teeth extracted and immediate dentures placed for the first few weeks? What's going to happen? Well, I have a list of things to consider, and so let's get right to it. Hey everybody, it's Dr. Chris Nelson here, and today I want to talk to you about an important topic. Item number 1, manage your expectations. Okay, so when you get dentures, your whole face will look different, they'll feel different, your bite will be different. We're going to go through those items, but what you need to keep in mind is the patients that have better expectations, as in they kind of are expecting things to be bad and get better. The patients that have, or even lower expectations, if they're just like, oh my gosh, this is going to be rough, those patients tend to do better in general with their outcomes. Now, I don't know if it's a better attitude or a different attitude, but our patients that think everything's going to be perfect and we're going to put them right in and they're going to chew everything, they're going to eat steak right away, all of these things, those patients have a harder time getting used to dentures. So that's item number 1. Manage your expectations and you'll have a better outcome throughout the process. Item number 2, keep your teeth in place. I have a whole separate video on this, but basically when you have your natural teeth removed and dentures placed, you need to do everything in your power to keep your denture teeth in your mouth during the healing process, especially during the first few days. Refer to my other video for specifics about that, but basically it's really important to keep your dentures in your mouth during the first couple days. Item number 3, expect chewing to be really difficult. So when you get your dentures, it's going to be really hard to chew on things. I have patients that do really well right away, but the majority of people, when they get their new dentures in their mouth, things move around, things are tippy, and there's 2 prosthetics in their mouth. It's just really hard to get used to that. So you need to manage that expectation, but expect chewing to be just really difficult to begin with. You will get better at it, and but at first it's going to be rough. So expect chewing to be really challenging. Item number 4 is shrinking gums equals loose teeth. So right away when you have your teeth extracted and the immediate dentures placed, the denture is going to fit pretty well, it should. And then the tissue, your gums are actually going to swell and the denture is going to be really, really snug. So day 2, day 3, the swelling gets more and more and more, and then usually day 4, day 5, day 6, the swelling starts to shrink. Well, when you get out to 1 week, 2 weeks, 3 weeks, 4 weeks, those gums are going to shrink and remodel as the bone heals, and the shape of your gums and the bone under it is going to be smaller in most places. And all of a sudden, like the upper denture is going to start to be loose and rocking, and that's going to be even more challenging. So you should plan with your dentist for some follow-up visits after the teeth are removed so that you can manage those shifting bites and manage some aesthetic issues in terms of how they look. Item number 5, tissue conditioners. So some people call them soft relines, tissue conditioners, functional impressions. There's a lot of different names for what I'm talking about, but what you are essentially doing is, as I mentioned, as the gums shrink and remodel, the denture is going to move a lot. So what we would need to do is, in the areas that have gotten smaller, there's going to be a gap between the edge of the denture and your gums, and that's causing the instability. So we would actually use a reline material or a tissue conditioner or a silicone material to refit the denture. Now, what you'll notice is the denture will eventually get thicker and thicker and thicker, and that's because your gums used to be out here and now they're here. Well, that space needs to be filled in, and it's going to get really thick, and eventually you might even say, these dentures aren't made for me, you made them for somebody else because they're so thick. And that's not because the dentures got thicker, it's really because your gums shrunk. So expect the need for tissue conditioners. Typically we do those at a 1 or 2 month interval, and usually we have to do 2 or 3 of them after the extractions and before the next steps. Item number 6, your bite will shift and your teeth will shift as well. I'm going to use an RV analogy. If you've ever been camping in a travel trailer and you go out and you park the travel trailer there, and then you level everything out, and then a couple days later, if you stayed for a couple days, all of a sudden the RV might not be level, and you go, well, it was level when I got here. Well, it's not the RV didn't move per se, the structure of it. It's actually the ground under the RV that has shifted. So the idea there is, with your gums, we've built a prosthetic in advance off of some impressions or a scan that was taken before you had the teeth removed. So we have to do some estimating, and we're really good at it, but we have to do some estimating about where the teeth are going to go. And we do not account for uneven shrinking. So you might have a side over here where it goes up like this, and then the bite kind of levels out like this for a while, and then 2 months later everything's like this, and then 3 months later everything's so loose that we can actually move your teeth in your mouth and re-level the horizon. So that's something that you need to be expecting, that the horizon of your teeth might look really good to begin with, but then all of a sudden later it's shifted quite dramatically, and most of the time the dentist can readjust that when they're doing the tissue conditioners. Okay, last item is the next steps. So I want to walk you through a case to describe the next steps, and I will skip ahead and basically tell you that the next steps are essentially either a hard reline for your immediate dentures or an entire remake of your immediate dentures. And you can use different technologies to remake the denture. You could make a digital copy of it, or you could remake the denture using traditional techniques. Different dentists prefer different methods, and different labs do different methods really well. So, but either which way, you're gonna have a denture that doesn't fit, it has tissue conditioners in there. You're probably going to want either that denture to be hard relined, or you're gonna have a second denture or a copy of that with changes incorporated. I'll do a video some other time, but the main message is that this first set of teeth is probably not going to be a forever set for you. You might even decide you want implants. So it's the sort of thing that you're going to have to either do a hard reline or a new set. And a lot of patients, because they get very attached literally to their teeth, they actually don't want me to send their teeth away, so they lean towards either doing a 3D copy with some scanning technology, which has pros and cons, or we make a new set of dentures. So both of those are different options, and we can kind of work through that depending on the patient. So this particular case, this patient came to us with teeth that were okay but not great, and some partial dentures that were okay but not great. And as we did our very comprehensive exam, we figured out that the teeth were actually in a lot worse shape than the patient knew about. So we made a plan, we made financial arrangements, and we planned on doing immediate dentures. In this particular case, I extracted the teeth in the office. We do that sometimes. A lot of times we work with oral surgeons or periodontists to do that. But this particular case, I remember pulling the teeth and delivering immediate dentures. We went through the process where the dentures were nice and snug, and then they eventually got looser and looser, and we relined the dentures. So we have photos here of the dentures with tissue conditioners in there. At that time, we were using a material that is white and would take a couple days to get set. These days, a lot of times we use a silicone material that gets set faster, so there's pros and cons to both of those methods. They're both good. And so we ended up refitting the dentures multiple times, and then ultimately we ended up getting the smile corrected. We had some shifts and cants, and then the patient was trying to figure out whether he liked dentures or wanted to get some implants or whatnot. And at the end of the healing process, we did end up making a second set of dentures. And in this particular case, the set of dentures we made were actually porcelain teeth dentures, which back in the day and currently, if you don't want dental implants, it's some of the nicest, most premium ways of restoring teeth is with porcelain teeth dentures with a particular bite design that has a flat top and a blade on the bottom. But that's I actually have a separate video on porcelain teeth dentures. It's an older one. You get to see a younger version of me. But in any case, this particular case, we walked through all of the process of initial presentation, tissue conditioners, multiple tissue conditioners, refitting, some sore spots. A patient that I remember, he was pretty disappointed with having no teeth. That was a very emotional process for him, and we walked him through it, and we helped him get to the end point where he was really happy with his porcelain teeth dentures. And the photos we have here show that his smile looked really nice the last time we saw him. So anyways, I hope you are doing great, and I hope that you learned something. And if you have any questions about this, just leave it in the comments. I like to reply to those. If you're in the greater Redding area, Northern California, and you're interested in something like this, you can reach out to us. We love meeting new patients, and we love helping people with immediate dentures and working through that whole process. So thank you very much, and you guys have a great day and a happy new year.